Imagine waking up tomorrow and discovering your doctor has prescribed a simple activity that could reduce your prostate cancer risk by 30%, improve your cardiovascular health, enhance your immune system, and help you sleep better. Now imagine being told that millions of men over 60 are actively avoiding this exact health-preserving activity because of embarrassment, misinformation, or simply not knowing its importance. Today, I'm revealing the silent health crisis affecting men over 60 that no one is talking about, and the surprisingly simple solution that many doctors won't discuss with their patients. Hello, I'm Dr. Julia Merrick. For over 11 years, I've dedicated my practice to helping men in their 60s, 70s, and beyond reclaim their vitality and intimate well-being when they thought it was lost forever. Today, we're addressing something crucial that's missing from most conversations about men's health after 60. The critical importance of regular ejaculation, not just for sexual satisfaction, but for your overall physical health and longevity. What you'll learn in the next 20 minutes might completely transform your understanding of how your body works after 60 and give you practical tools to protect your health starting today. When a man over 60 stops ejaculating, whether due to health issues, medication side effects, or relationship changes, his body doesn't simply adjust and move on. What many men don't realize is that the prostate continues producing fluid regardless of whether it's being expelled regularly. Research from the Harvard Medical School shows that men who ejaculate at least 21 times per month have a 30% lower risk of prostate cancer than those who release only 4 to 7 times monthly. But what happens when this release stops completely? First, prostatic fluid accumulates, potentially leading to inflammation and increased pressure. Second, the muscles involved in ejaculation begin to weaken from disuse, making future function more difficult. Third, and this surprises many of my patients, your testosterone utilization becomes less efficient as your body's feedback systems sense less need for reproductive function. Most concerning is that within just 60 days of no ejaculation, many men experience noticeable increases in prostate size and urinary difficulties that could have been avoided. But here's what few men know. This process is reversible at almost any age, and I've worked with men well into their 80s who have restored healthy function using the techniques we'll discuss today. Do you recognize any of these warning signs? Increased nighttime urination, a feeling of incomplete emptying, or diminished desire? These are early indicators that your body's natural release system needs attention before more serious issues develop. While your doctor might discuss erectile dysfunction or prostate health, there are 7 consequences of prolonged abstinence that rarely get mentioned in brief medical appointments. First, increased risk of prostate inflammation. When fluid isn't regularly expelled, it can become a breeding ground for bacteria. Second, elevated PSA levels. Many men find their prostate-specific antigen readings increase during periods without ejaculation, sometimes triggering unnecessary medical interventions. Third, pelvic floor tension. The muscles that support healthy sexual function require regular use. Without it, they become tight and inefficient. Fourth, decreased nitric oxide production. This vital compound helps blood vessels dilate for proper circulation throughout your intimate areas, but its production diminishes without regular stimulation. Fifth, emotional disconnection. The neurochemicals released during ejaculation, including oxytocin and dopamine, play crucial roles in mood regulation and emotional bonding, even for men living alone. Sixth, disrupted sleep patterns. Many men don't realize that regular sexual release helps regulate sleep hormones, which become increasingly important after 60. Seventh, and perhaps most overlooked, increased urinary tract infections. Regular ejaculation helps clear the urethra, reducing infection risk in older men. What's most troubling is that these issues compound over time, creating a downward spiral where each problem makes the others worse. But understanding these dangers is your first step toward addressing them effectively. Your prostate, a small gland about the size of a walnut, plays an outsized role in your overall health after 60. But few men understand the critical connection between ejaculation and prostate health. The prostate produces approximately 30% of your seminal fluid. When this fluid isn't regularly expelled, it can become thicker and more concentrated, potentially leading to calcifications, tiny stone-like formations that can irritate this sensitive gland. A landmark study published in European Urology followed 29,000 men for nearly 2 decades and found something remarkable. Those with more frequent ejaculation had significantly lower rates of prostate problems across all age groups, but the benefit was most pronounced in men over 60. Here's what happens physiologically. During ejaculation, the entire prostate contracts, essentially flushing accumulated fluids and potential inflammatory compounds. Without this regular cleansing process, these substances remain in contact with prostate tissue for extended periods. Many men tell me they've been told that diminished sexual function is simply part of aging, but medical evidence strongly disagrees. While changes occur, the need for regular prostatic emptying becomes more important with age, not less. What's most concerning is that many men incorrectly believe that if they're not sexually active with a partner, this function becomes irrelevant. In reality, self-stimulation provides the same physiological benefits for prostate health, regardless of whether a partner is involved. Remember, your prostate doesn't know the difference between types of ejaculation. It only knows whether it's being regularly emptied and exercised, which is critical for maintaining its health and function well into your 80s and beyond. Now that you understand the importance of regular release, let's discuss 3 practical morning techniques that can help restore natural function, even if you've experienced difficulties. The first technique involves hydration timing. Most men don't realize that morning testosterone levels are naturally highest, but proper hydration is essential for this hormone to function effectively. Drink 16 ounces of room temperature water immediately upon waking, then wait 30 minutes before any caffeine consumption. This simple adjustment helps optimize your body's natural hormone peaks. The second technique addresses circulation. Poor blood flow is often the hidden culprit behind diminished function. Each morning, perform this 3-minute circulation exercise. While seated on the edge of your bed, place your palms on your thighs, take 5 deep breaths, then gently press and release your palms against your thighs 50 times while focusing on feeling increased warmth in your lower body. This gentle pressure activates peripheral blood vessels and improves circulation to your pelvic region. The third technique involves prostate stimulation, but not in the way you might think. Many men benefit from external prostate activation. While seated, contract your pelvic floor muscles, as if stopping urination, for 3 seconds, then release completely. Repeat this 10 times each morning. This simple exercise improves blood flow specifically to the prostate and strengthens the muscles involved in ejaculation. The key to success with these techniques isn't intensity, but consistency. Men who perform this 3-part morning ritual for 21 consecutive days report significant improvements in natural function, regardless of how long they've experienced difficulties. Remember, these techniques work with your body's natural processes rather than forcing function, making them both effective and sustainable for men of all ages. When it comes to restoring healthy ejaculatory function, certain approaches build confidence while others silently undermine it. Let's separate what truly works from what destroys your progress. What destroys confidence? Focusing exclusively on achieving erections. Many men become fixated on erection quality, creating performance anxiety that actually inhibits natural function. Instead, shift your focus to sensation and pleasure, allowing arousal to develop naturally. What works? Progressive stimulation training. Begin with gentle, indirect stimulation of surrounding areas before direct contact. This technique retrains nerve sensitivity, particularly effective for men experiencing decreased sensation due to medication or health conditions. What destroys confidence? Setting time-based expectations. Watching the clock creates stress hormones that constrict blood vessels, exactly the opposite of what's needed for healthy function. What works? The 20-minute rule. Allow yourself a minimum of 20 minutes of relaxed, pressure-free stimulation before expecting results. This time frame allows your body's parasympathetic nervous system to activate fully, essential for men over 60. What destroys confidence? comparing current function to past experiences. Your body at 60 plus has different needs and responses than it did decades ago. What works? Mindful focus techniques. When your thoughts drift to comparison or worry, gently return focus to physical sensations in the present moment. This mindfulness practice has been shown to significantly improve both satisfaction and physiological response in men over 60. What destroys confidence? Attempting function when fatigued or immediately after meals, when blood flow is diverted to digestion. What works? Timing optimization. Most men over 60 have a natural window of heightened response, typically in morning hours or after a brief afternoon rest. Identify and utilize your optimal timing for significantly better results. By avoiding these confidence destroyers and implementing what actually works, you create the conditions for your body's natural abilities to return, often more fully than you might expect. Your diet directly influences your ejaculatory health through several pathways: hormonal balance, blood vessel function, and nerve sensitivity. Let's examine 5 specific foods that research shows can unlock your body's natural ability to release. First, watermelon. This refreshing fruit is one of nature's richest sources of L-citrulline, an amino acid that converts to arginine in your body, boosting nitric oxide production. Nitric oxide relaxes blood vessels, improving flow to all areas including your genital region. 2 cups of fresh watermelon 3 times weekly provides therapeutic levels of this compound. Second, walnuts. These brain-shaped nuts contain rare plant sterols that support healthy testosterone utilization, not by artificially boosting levels, but by helping your body use available testosterone more efficiently. 7 walnuts daily provides the optimal amount without excess calories. Third, beets. The natural nitrates in beets convert directly to nitric oxide in your bloodstream, with effects lasting up to 8 hours after consumption. 1/2 cup of beets or 4 ounces of beet juice before noon provides sustained circulatory benefits throughout the day. Fourth, pomegranate. Studies show this ancient fruit significantly improves arterial health and blood flow. The active compounds in pomegranate protect nitric oxide from breaking down too quickly in your bloodstream, extending its beneficial effects. 4 ounces of unsweetened pomegranate juice provides therapeutic benefits. Fifth, dark chocolate, 70% cocoa or higher. The flavonols in high-quality dark chocolate improve endothelial function, the lining of your blood vessels, allowing better dilation and increased flow. 1 ounce daily, preferably in the afternoon, provides optimal benefits without excessive sugar. What most men don't realize is that these foods work synergistically, meaning their combined effect is greater than each individually. Incorporating all 5 into your weekly routine creates a foundation for improved function that becomes noticeable within approximately 14 to 21 days. Now, let's discuss a structured approach that has helped thousands of my patients restore healthy ejaculatory function: the 30-Day Restoration Challenge. This systematic program gradually rebuilds your body's natural capabilities through consistent, progressive steps. Week 1 focuses on foundation building. Perform the morning ritual we discussed earlier daily. Eliminate alcohol completely. Even small amounts significantly impact function. And incorporate 2 of the recommended foods daily. During this week, engage in gentle self-stimulation for at least 10 minutes every other day, without expectation of results. You're simply re-establishing the mind-body connection. Week 2 introduces circulation enhancement. Add 5 minutes of brisk walking before each self-stimulation session. As research shows, this short burst of activity increases pelvic blood flow by up to 40%. Increase stimulation sessions to 5 minutes daily, focusing exclusively on sensation rather than outcome. Week 3 focuses on pelvic floor strengthening. Add the contraction exercise we discussed earlier, performing 3 sets of 10 contractions daily. Increase stimulation sessions to 10 minutes daily, now with the intention of achieving release, but without pressure if it doesn't occur. Week 4 integrates all elements while adding mindful breathing techniques. Synchronize your breathing with stimulation, using slow 4-count inhalations and 6-count exhalations. This breathing pattern activates the parasympathetic nervous system, essential for healthy release. Continue daily sessions of at least 15 minutes. The remarkable aspect of this 30-day challenge is its cumulative effect. Even men who see no noticeable changes in the first 3 weeks often experience significant improvement during week 4, as the body's systems respond to the consistent signals and support you've been providing. What makes this approach different from simply trying harder is its comprehensive, systematic nature, addressing physical, nutritional, and psychological factors simultaneously, which is particularly effective for men over 60. While diminished ejaculatory function itself is concerning, certain warning signs indicate you may be at higher risk for serious complications if not addressed promptly. Recognizing these signals early can prevent significant problems. First warning sign: increasing urinary frequency, especially at night. When your prostate enlarges from lack of regular emptying, it puts pressure on your urethra, often manifesting first as nighttime urination. If you're rising more than twice nightly, this warrants immediate attention. Second warning sign: discomfort or heaviness in the lower pelvic region. This sensation often indicates prostatic congestion from inadequate emptying, which can progress to inflammation if not addressed. Third warning sign: diminished force of urinary stream. This subtle change reflects increasing prostatic pressure on the urethra and often precedes more serious urinary difficulties. Fourth warning sign: loss of morning erections. While not directly related to ejaculation, the absence of these natural nocturnal erections indicates circulatory changes that affect all aspects of sexual function. Fifth warning sign: extended periods, more than 30 days, without ejaculation. Even without other symptoms, this time frame itself represents a risk factor for prostatic complications. Most concerning is when multiple warning signs appear simultaneously or progress rapidly. In these cases, the 30-day challenge we discussed should be implemented alongside consultation with a healthcare provider familiar with men's sexual health. Remember, these warning signs rarely resolve spontaneously, particularly after age 60. They typically indicate your body's need for the natural release mechanism that ejaculation provides, and the longer these warnings persist, the more difficult restoration becomes. I've found that men who address these signs within the first 3 months of appearance have significantly better outcomes than those who wait longer, making early recognition and action essential. While we've focused primarily on prostate health and sexual function, regular ejaculation provides numerous additional benefits that few healthcare providers discuss with their older male patients. First, immune system regulation. Research from Wilkes University demonstrated that men with regular ejaculation, 1 to 2 times weekly, had significantly higher levels of immunoglobulin A, an important immune antibody that protects against respiratory and urinary tract infections, particularly important for men over 60. Second, stress hormone reduction. Regular release significantly lowers cortisol levels, the primary stress hormone that, when chronically elevated, contributes to everything from weight gain to cognitive decline, 2 concerns many older men face. Third, improved sleep quality. The neurochemicals released during ejaculation, particularly prolactin, help regulate sleep cycles. Men who maintain regular ejaculatory function report deeper, more restorative sleep, addressing a common challenge for many in their 60s and beyond. Fourth, cognitive protection. Surprising research from Coventry University suggests that regular sexual activity, including self-stimulation, is associated with better cognitive function in older adults, particularly in memory and executive function areas. Fifth, cardiovascular conditioning. The increased heart rate and blood flow during arousal and ejaculation provide a form of interval training for your cardiovascular system, particularly beneficial for men who may have limitations with traditional exercise. Sixth, pain reduction. The endorphins released during ejaculation are natural pain modulators, with effects lasting up to 24 hours, offering relief for men managing chronic pain conditions. What's most remarkable about these benefits is that they occur regardless of whether ejaculation happens with a partner or through self-stimulation. Your body responds to the physiological event itself, not the context in which it occurs. Understanding these wide-ranging benefits helps many men reframe their thinking about sexual function from merely recreational to an essential component of their overall health maintenance strategy. For men in relationships, addressing ejaculatory health inevitably involves a partner, often creating layers of complexity around communication, expectations, and shared vulnerability. Let's discuss how to navigate this territory effectively. First, recognize that diminished function affects both partners emotionally, but often in different ways. While you may experience frustration or embarrassment, your partner may feel rejected or worried about your health. Acknowledging these different perspectives creates the foundation for productive communication. Second, separate intimacy from performance. Many couples over 60 benefit from establishing regular physical closeness without explicit sexual expectations, creating an environment where natural arousal can develop without pressure. Third, consider a gradual reintroduction approach. Rather than attempting full intimate encounters immediately, many couples successfully rebuild intimacy through a progressive process, beginning with non-genital touch for several sessions, then gradually reincorporating more explicit intimacy as comfort increases. Fourth, communicate about timing. Many men over 60 find their natural response strongest in morning hours. Yet traditional intimacy often occurs in evenings when fatigue impacts function. Having an honest conversation about optimal timing can significantly improve outcomes. Fifth, consider partner involvement in the restoration process. Some couples find that treating the 30-day challenge as a shared journey reduces performance pressure while strengthening their connection. This approach transforms potential embarrassment into collaborative care. A particularly effective technique many couples discover is guided stimulation, where the partner provides stimulation following specific guidance about pressure, pace, and technique, creating both physical arousal and emotional connection simultaneously. Remember, partners who have shared decades together have unique advantages in addressing these changes: a foundation of trust, knowledge of each other's responses, and commitment that extends beyond physical performance. These relationship strengths become powerful assets when thoughtfully engaged in the restoration process. We've covered extensive ground today, from understanding why regular ejaculation remains physiologically necessary after 60 to specific techniques for restoring this vital function. The research is clear. Maintaining this natural release mechanism isn't optional for optimal health. It's essential. Whether you're currently experiencing difficulties or simply want to prevent future problems, the approaches we've discussed provide a roadmap for maintaining or restoring this important aspect of your health. If this content was valuable to you, please like this video, subscribe to the channel, and leave your questions or experiences in the comments section. And now, don't stop here. Click on the next video appearing on your screen and continue learning with me, Dr. Julia Merrick, how to live with greater vitality, confidence, and pleasure, even after 60. I'll see you there.